I'm here today to talk to you about have a conversation around COVID and about why you got vaccinated. What do you all think that some people are hesitant in getting the vaccination?
I think,
the unknown.
Yeah, the unknown. I think humans have, it's easy to fear something when you don't know about it.
So I was one of those people who waited a little bit, just because the unknown, you never know. It was very new, and there was a lot of information that, wasn't backed up by research or fact. And I just didn't feel confident enough to form an opinion without knowing what I know now.
Yeah, definitely. Like you, I waited a little bit. Like you said, there wasn't a lot of articles or research that I had seen at the start that backed up. But I mean, doctors and medical professionals wouldn't give out a vaccination if it was completely unhealthy for people.
I think a lot of the time it's people are getting confused with opinion over fact. So I think that's where social media played a really big part, because social media is just an untethered power, and it's purely open to interpretation. It's not always, it's very rarely backed up with fact. It's purely driven by opinion. So I think that's where a lot of that confusion began.
Yeah, I mean, so I certainly can understand why people were hesitant or concerned at the start when we just rolled out a new vaccine. As you said, there were a couple of new different types that we don't usually use. We know a lot more about it than we did before, and we know that it is a safe vaccine.
It was probably just a matter of ringing up and booking it. Yeah, like once I booked it in, it was no problem, but yeah, it was just getting around to just ringing up.
I think because we've got so many immunisation, there's measles, there's all those other ones that younger ones get, so it's just an extension of all that.
Yeah, we also trust our GPs to look after our health, so if we can give them the ability to trust the decisions from their doctors and scientists and all the people that are working relentlessly to care for our fellow Australians, they should think about that.
I think that's what it is, it's education.
Educate yourself. It's like what Auntie Catherine was saying, like it's just an extension of all the other immunisations. It's just standard. We have children, we immunise them. This is just another extension. It's just one more needle. It's doing more good than it's doing harm.
Also, there's a part of our population is terrified of needles. So it's not so much the immunisation, it's the fear of having an injection.
So look, we've certainly had lots of people who've either have scared of needles and need a lot of support for that, or have got other disabilities that mean they need extra support to get vaccinated. And there are a number of ways that people can access in that situation, and some general practitioners will be able to support your clients or people through that. But also the hospital and health services often have programs where they can support someone through vaccination, which may include other medical therapy at the time. So I think people need to contact the GPs or their local, someone in the medical profession around them to try to access those programs.
It's more in the head, like you just overthink it. And when I got into the doctor's room, I just said, do it straight away, don't talk to me. And then I didn't even realise it was done until she said it was done. I was looking the other way, but it's not that bad.
Yeah, it's really quick and easy. You walk in and you walk out. It's really easy. I think with the younger generations as well, we tend to have this carelessness rather than the elder generation who think about their health a little bit more. But it is a serious thing, and you need to go get your vaccination done. Yeah.